Let's talk more about this with Dr. Henning Ansdorf from Santa Barbara County Public Health. Good to see you again, Doctor. Santa Barbara County paused, along with everybody else, when they're no longer using the Johnson & Johnson vaccine when this news broke. Was that the right call, being that it appears to be such a very, very low risk?
Yes, I would say it's the right call because we have to make sure that, the vaccines we are giving are safe. The Johnson & Johnson vaccine looked very good on the trial data, but now that we saw these rare blood clots in 6 recipients of the vaccine, it has to be paused until the investigation is completed.
What do people who got the Johnson & Johnson vaccine, I got it last week, what do we need to know? What should people be on the lookout for?
All right, I want you to really watch out for headaches that are getting worse. That would be a potential symptom for a clot in the veins inside the brain, because then the blood accumulates and it leads to pressure on the brain, and that would cause headaches. And it's very rare. But obviously, if that were to occur, or vision changes because of the swelling of the brain, the eyesight gets worse. And things like that within 2 weeks after the Johnson & Johnson vaccine are very concerning, and you should definitely seek medical attention right away.
So after those 2 weeks, does it appear that most people would be in the clear?
Yes, I would say latest after 3 weeks, you should be totally out of the woods.
Okay.
For any of this to occur.
And then you guys have been using this. The Johnson & Johnson is that impacting the supply within Santa Barbara County? I know Pfizer and Moderna are the main ones, but you had these big clinics that were set up using J&J as well.
That is correct. But fortunately, we have enough Moderna vaccine that we can easily pivot and utilize Moderna. We don't have that much scarcity at the moment in Santa Barbara anymore. And please remember that the Johnson & Johnson was only 5%. or a little less than 5% of our vaccination vaccine supply. Like we have given 250,000 doses of Moderna and Pfizer, and only 12,000 of Johnson & Johnson in Santa Barbara.
Have we had any local reactions to the Johnson & Johnson vaccine?
We did have one person who had a fainting episode or questionable seizure after receiving the vaccine, but it all cleared up very quickly, was evaluated in the emergency room and cleared to go home.
Interesting. Okay.
That was the only one in 12,000 cases.
Interesting. All right. So this shot's also being used to get to harder to reach populations because it didn't need to be kept at super cold temperatures. It's only one shot. Farm workers, for instance, will this hurt the vaccine outreach to some of these hard to get to communities?
Likely, yes. Now, fortunately, we still have the Moderna vaccine that doesn't have to be super frozen either. So we are pivoting and utilizing that for now until the Johnson & Johnson investigation is cleared. Now, I would like to say that it's quite possible that the CDC comes up with assessment that the blood clots were not caused by the vaccine, but because we are obviously looking for any kind of adverse event or side effect after vaccine, it gets picked up. Please keep in mind that 3 to 4 in a million population of this happens without having a vaccine, and we've seen 1 in a million. So a third of the natural occurrence of this unfortunate brain thrombosis. So it's still possible that the Johnson & Johnson will be cleared and get the stamp of approval, but until then, we just wait.
We're just kind of waiting. And we've heard abundance of caution a lot over the last couple of days. All right, so let's talk cases. They are down. Hospitalizations are down. Overall vaccination effort, besides Johnson & Johnson, is way up. When are we going to hit the orange tier?
Very soon, very soon, yes. I look today, we are at 5.2. We have to be below 6 come Monday evening. And everything looks good so far. And then we will be in the orange tier come Wednesday.
Awesome. And that would mean good things for businesses, restaurants, retail, all of that. Also, gatherings is a big question. We're coming up on summer. We have Fiesta that is normally a big summer activity, 4th of July fireworks, the Santa Barbara Bowl is looking to get things going again. Is this stuff going to continue? Will we see some of that once we get into the summer?
I think we will have more of these activities with modifications still in place. You know, we don't know who is vaccinated, who isn't. So you don't want to stand in a crowd watching the fireworks or sit in a crowd too close without wearing a mask, even in July. I don't think so. If you're fortunate enough, you can watch it from your back porch and you are fully vaccinated and your friends who come over are fully vaccinated, you're all good and safe to enjoy that social event. And similar for the fiesta, that's a very good question, but that's in August, so we still have a lot of time to play with the vaccines and come up with a good plan for that one.
Got it. All right, Dr. Henning-Ansbach, thank you so much for joining us. We appreciate it. Spending a little more than 5 minutes today with us here on Midday. Appreciate you. Thank you so much.
Of course, my pleasure.